Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association. Well, this week we received the long-awaited publication of the revised Infection Prevention and Control, or IPC, guidance. And as anticipated, it incorporated many of the recommendations of the Scottish Dental Clinical Effectiveness Programme, or SDCEP, report from last month. It's been welcomed by many as a more pragmatic approach, in particular on downtime after aerosol generating procedures, but it's also thrown up a few new issues. Well, now that it's here, we can expect to see each of the UK nations respond by outlining the practical implications for dentistry in their countries. So I just wanted to highlight 5 significant points on the back of the new IPC guidance. There's been an awful lot of guidance over the past 6 months, and not all of it has been consistent. We know that has caused some frustration. So now, from SDCEP to IPC, we have consistency, and that's certainly a positive. Inevitably, there will be local nuances in the 4 national approaches, but it does feel that as if we're seeing a convergence rather than further deviation. And that's reflected in the advice offered by the Faculty of General Dental Practice, as well as our own BDA toolkit, which we are in the process of reworking at the moment, and we'll make that available for members as soon as we can. We anticipate a new standard operating procedure for England early next week, and as soon as we have that, we'll publish our updated toolkit for England. The new guidance places a heavy emphasis on the need for appropriate ventilation and air changes, in particular for practices to be able to get fallow time down and patient activity levels up. And that makes sense, but there is significant variation in the ventilation that practices currently have, and indeed in terms of what they can actually achieve. Depending on infrastructure, some practices might require significant building work. Others might be in rented premises, where it's not an option, whilst others will be restricted by practicing in older and even listed buildings. So getting fallow time down is going to take significant work, and we need governments across the UK to commit to capital investment for dentistry to deliver that change, and we are already making that case to those governments. We're also concerned particularly for practices with surgeries without natural or alternative mechanical ventilation. New guidance says that such surgeries should not be used for aerosol generating procedures at all. According to our latest survey, which is still in the field, that could affect a small but significant proportion of practices who operate with surgeries that don't have natural ventilation. So this is a significant issue, and we ask that the authorities adopt a pragmatic and supportive approach as such practices look to adapt. We all remember the discourse from the early days of the pandemic around which masks should be used in which situations in dentistry. As time went by, FFP2 masks became the default for aerosol generating procedures for many. Meanwhile, the IPC advice said that FFP3 masks were the preferred option, but FFP2 masks could be used where FFP3s remained unavailable. Well, the new IPC dental appendix does not refer to FFP2 masks at all, and that's understandably causing some concern. We cannot head back to a situation where demand for FFP3 masks outstrips supply, and as a result, prices skyrocket. In England, we're told that FFP3 masks should be available via the new NHS portal. However, colleagues are reporting that isn't yet the case, and the fact remains that the portal is not a solution for private dentistry. We need an ongoing pragmatic approach on this issue across all 4 nations. The new re-establishment guidance already published in Northern Ireland talks about continuing to use FFP2s where FFP3s are unavailable or that fit testing is unavailable, and this seems an attempt at compromise. We've all seen the dramatic shift in the way that dental teams have delivered care, both during lockdown and since returning to face-to-face practice. So it's no surprise to hear that the overwhelming adjustments that dentists have had to make in the midst of a global pandemic have had an adverse impact on mental health and well-being. Physical and mental intensity of providing AGPs in high-level PPE is extraordinarily wearing. We like to see increased levels of stress and anxiety in dental teams as a result, and we need to look out for each other. was glad to see reference to this issue in the Northern Ireland re-establishment advice this week. I hope everyone is aware of the support that's available out there, including the BDA's own Health Assured service. Please get help if you think you need it, or if you think colleagues need it. The reduction in fallow time is a welcome opportunity to increase the level of care for patients. But you don't need me to tell you that we're not going to see a return to pre-pandemic levels of activity in the near future. We must continue to reinforce to patients that it's safe to get dental care. However, the public and politicians also need to be realistic. There will continue to be limitations on the amount of care that can be delivered. Dentists and teams are working hard to look after their patients, but with enhanced cleaning, social distancing, and the physical demands of working under high-level PPE, they're simply unable to treat as many patients as before. Politicians and officials must be clear that any expectations of anything like near normal levels of activity in the near future are simply unrealistic. So, what's next? Well, we now await the publication of new guidance to reflect the IPC positions in the other nations alongside Northern Ireland. We anticipate that those should equally be consistent with the IPC SDCEP guidance and the procedures that Northern Ireland have published. There's also detailed work ongoing across the UK, of course, on changes to the various NHS contractual frameworks. News on the contract in England we know is well overdue, but please be assured we're doing what we can to try and make sure that the outcome is fair to the profession. We'll update you when we can. In the meantime, please continue to deliver the previous levels of NHS care. I'll be back again to update you by video to discuss the outcomes of all these things when I can. Till then, please have a safe and healthy weekend.